This week, the Minnesota legislature agreed to a rescue plan for HCMC and other hospitals, and CMS is turning its attention to states besides Minnesota to look for fraud. Welcome to the May 15th edition of Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Lawmakers agreed to an end-of-session deal this week, laying out a series of budget targets that will play out through the weekend at the Capitol. The terms included what many consider the top of the legislature's to-do list, a rescue plan for Hennepin Healthcare and HCMC. The Minneapolis hospital told state officials it is facing a $200 million deficit this year and could close, as the Minnesota Reformer said this week that HCMC treated patients from 86 of Minnesota's 87 counties last year. This week's deal at the Capitol sends $205 million to Hennepin Healthcare in the short term and establishes a $500 million safety net fund for failing hospitals in the state. Michelle Benson is the Senior Director of State Government Relations with the Minnesota Hospital Association.
It's available to hospitals that are in a situation like HCMC or worse. The details of that have yet to be fleshed out. Governance will be part of any of access to those funds, and so we're cautiously optimistic that the hospital's financial situation has been heard here at the Capitol, but again, the devil is always in the details.
Political analyst Stephen Scheer told KSTP-TV that he expects lawmakers will demand some changes in the way that HCMC is run in return for the rescue.
This is very much a red flag to the legislature that oversight is necessary in the future in order to keep problems like this from erupting.
KSTP also reported that the Hennepin County Board of Commissioners, which took over running the hospital last summer, will relinquish that role and reestablish an independent governing board by early 2027. The Star Tribune also reported that HCMC wasn't alone. It said today that MHA Health in southwestern Minnesota is nearing the brink of closure, turning to bridge loans to make payroll some weeks. MHA is one of more than 30 financially distressed hospitals in the state that have lost money in half of the last 8 years. Meanwhile, still to be determined at the Capitol, the fate of a measure that would enforce a 2024 Minnesota law that would compel drug companies to provide federal 340B drug pricing program discounts to any eligible pharmacy in the state. The program provides more than $1.3 billion a year in funding to Minnesota hospitals, according to a recent Minnesota Department of Health report. Drug companies have been fighting the state law and mounting a months-long advertising campaign to blunt a new enforcement mechanism that's already been approved in the Minnesota Senate and is awaiting House action. Again, Michelle Benson.
We're hearing opposition declining. That doesn't mean there's an easy path.
Lawmakers from both parties called for the House to approve new enforcement measures at a press conference at the Capitol on Tuesday. Republican Natalie Zalesnikar, who represents parts of Duluth, Hermantown, and Two Harbors, is sponsor of the measure in the House.
We can get something done before the end of session to provide some stability and certainty for our hospitals in the state of Minnesota for the years ahead.
There was other news at the Capitol this week. Lawmakers approved a new state office of the Inspector General to investigate allegations of fraud, independent of any current administration. It's been a major push by Republicans who have decried hundreds of millions of dollars in documented Medicaid fraud during the Walz administration. The legislative session effectively wraps up with final votes on Sunday, although lawmakers will convene for a ceremonial floor session on Monday. And there were other health headlines in Minnesota this week. Mayo Clinic CEO Gianrico Ferrugia said he plans to step down at the end of 2026. He follows precedent among recent Mayo leaders for serving most of, but not all of, a decade leading Mayo. He took the top job in January 2019. A successor is expected to be selected later this fall. And the Minnesota Department of Health said in a surprise announcement that it was monitoring a Minnesotan who may have had exposure to a passenger on board the Dutch cruise ship stricken by a deadly outbreak of hantavirus. State epidemiologist Dr. Ruth Linfield said her agency is in regular contact with the person and has asked them to stay home when possible and wear a mask when near someone indoors.
When we spoke with this person, it was a may have had contact, and so it is much, much less concerning than someone who was on the ship.
Linfield also said that she understood why people are worried about hantavirus.
Especially the picture of the cruise ship brings back for everyone 2020. I get it. But, we've seen this virus before. It has not resulted in a pandemic. We will learn more about it, no doubt. But the kind of communicability it has is different. So I think this is a very good approach.
Linfield said the hantavirus did have a longer incubation period than COVID, as long as 6 weeks, and that MDH would continue to monitor the person as part of the global surveillance of the outbreak. And did you see this? The United Health Foundation, the nonprofit arm of health insurance giant United Health Group, came out with a new state-by-state ranking for health of older adults. Minnesota ranked 4th among U.S. states among 36 measures, including social and economic factors, clinical care, and health outcomes. Vermont, Utah, and New Hampshire took the top 3 spots.
Also this week, after months of national attention on fraud in Minnesota, the Trump administration is turning up the heat on the rest of the country. Vice President J.D. Vance announced this week that states must prove they are aggressively prosecuting Medicaid fraud or risk losing funding. Ellen Florek has more.
Vance specifically called out New York, Hawaii, and California, adding that $1.3 billion in Medicaid reimbursements to California is being deferred. He said the state has refused to take fraud prevention seriously, and officials must now account for roughly $630 million in unexplained billing, $500 million in home health charges, and $200 million in questionable expenditures. The Centers for Medicare and Medicaid Services Administrator Mehmet Oz called it the largest deferral the federal government has ever made. CMS also rolled out a 6-month nationwide freeze on new Medicare enrollments for hospice and home health providers. In other federal news, CMS is expected to drop updated rules and regulations around state-directed payment programs and provider taxes next week. The update will have big implications for whether Minnesota's directed payment program is ultimately approved or how it will be implemented. State lawmakers signed off on the program last year, but it's been in limbo at the federal level ever since. If approved as written, it would direct about $1 billion in additional funding to Minnesota hospitals.
And that's it this week from Healthline, the weekly news podcast from the Minnesota Hospital Association. I'm Tim Nelson.
And I'm Abby Mocktig.
Thanks for listening.